Now, since we have learnt about the innate immunity, it's time to turn to the acquired immunity. The acquired immunity is also called as the adaptive immunity. This is the first part of the acquired immunity, where we will be discussing about the definition of the acquired immunity, the some of the salient features of the acquired immunity, and the types of the acquired immunity. So first of all, coming to the definition of the acquired immunity. The acquired immunity refers to the resistance that the resistance against the foreign substances that is acquired by an individual during the course of the life. Okay, so the resistance which is acquired during the course of the life by an individual is referred as the acquired immunity. Now, what are some salient features of the acquired immunity? So number one feature is that it is slow. Okay, the acquired immunity is slow. The response occurs in days, while in the case of innate immunity the response was occurring immediately, but here the response is occurring in days. Okay, and then the second point is that it requires a prior exposure. It requires a prior exposure. The innate immunity was not requiring any prior exposure. Then it is specific. It acts against those microorganisms more specifically to which it has been already exposed previously. Okay, so the previous exposure makes it a specific type of immunity. Then the memory is present. Okay, memory is present. The memory of the previous infection would be present with the acquired immunity. Then the mediators of the acquired immunity are the T cell, B cell, the complement pathway, and the cytokines. We will read about all of them in upcoming lectures. So these are all the salient features of the acquired immunity. In the university exams, they may ask you the difference between the innate and the acquired immunity. Then you should know the salient features to describe the difference between the two. Okay, now coming to the types of the acquired immunity. So acquired immunity is classified into the active immunity and the passive immunity. The active and the passive immunity, the simple difference is that the active immunity is that type of acquired immunity where the host's immune system is actively involved, while the passive immunity is that type of acquired immunity where the immunity is delivered to the host from outside without the active involvement of the host's immune system. So in the passive immunity, the host's immune system is not taking part actively. Okay, while in case of active immunity, the host's immune system is taking part actively. Okay, that is the difference between the active immunity. Let's refer to the definition here. The definition of the active immunity is that it refers to the resistance which is developed by an individual by active involvement of the host's immune system against any microorganism, while the passive immunity refers to the resistance which is acquired by an individual by passive transfer of ready-made antibodies. This is the line of difference, the passive transfer of ready-made antibody. This helps us in differentiating between the active immunity and the passive immunity. So in the passive immunity, there is passive transfer of the ready-made antibodies without the active involvement of the host's immune system. Remember, the difference between the active immunity and the passive immunity is very commonly asked in the university exams. So to simplify it and to for making it easy to memorize, I have made this table in a difference wise manner. Okay, so that it becomes easy for you all to remember this concept between the active immunity and the passive immunity. Now coming to the types of the active immunity. So active immunity has got two types, that is the natural active immunity and the artificial active immunity. The natural active immunity means the person has got the infection with some microorganisms, and then after that he or she becomes resistant to that microorganism, like the chickenpox infection. We usually the children's have this chickenpox infection in childhood, and after that they do not get the infection because they get the permanent immunity after that now, after the first exposure now. So that is the natural type of active immunity. The first time infection occurs, then the immune system of that child gets activated and keeps some cells as a memory cell. So in the further lifetime of that child, whenever that same pathogen comes, that memory cell will kill that pathogen and will protect that child in, in his future life from that infection. So that is the concept of the natural active immunity, while artificial active immunity is nothing but the concept of the vaccines. So whenever we inject some vaccine, that is, we are causing the first exposure with a particular microorganism. So in the vaccines, like suppose for sake of the I mean, for sake of understanding, let's take the example of the measles vaccine. Measles vaccine is a live vaccine, so whenever live attenuated vaccine, so whenever we are injecting that live attenuated vaccine, it is acting as the first contact of the host's immune system to that measles virus. Okay, and after that first contact, then the immune system knows about that measles virus very well. So whenever in future measles virus comes to infect to that child, then his immune system will tell that I know you, I have got the previous exposure of you in the form of vaccine. So that will protect the child from the measles infection in the future. So this is how the artificial active immunity acts, or this is how the vaccines act. Now come to the types of the passive immunity. So we have natural passive immunity and the artificial passive immunity. The natural passive immunity is nothing but the transfer of immunoglobulins in the form of, in the mother's milk. Suppose in the mother's milk there is transfer of IgA antibody from mother to the fetus, or the transfer of the IgG antibody through the placenta from mother to fetus. So these two are the examples of the natural passive immunity. Well, what about the artificial passive immunity? Please make it P. This is not A, this is P. Okay, so this is P. Artificial passive immunity is, the example of the artificial passive immunity is that the rabies immunoglobulin. So whenever someone has got the bite from a dog, or for that matter any animal, then he has to get the rabies vaccine. So if it is a category 3 bite, then we give the immunoglobulins plus the anti-rabies vaccines, ARV. So that immunoglobulin that we are injecting, that is ERIG or HRIG, human origin rabies immunoglobulin or equinus origin rabies immunoglobulin, whatever it may be, that immunoglobulin, as we are injecting from outside, so it acts as the artificial passive immunity. Okay, so that's the difference between the natural passive immunity and the artificial passive immunity. Now come to the salient features of the active and the passive immunity in a difference wise manner, so that it becomes easy for you all to write the difference as well as the short note whatever comes in the exam. So the salient features of the active immunity and the salient feature of the passive immunity. The salient feature of active immunity says that the memory is present in the active immunity. While in passive immunity, as we are injecting or as the host is getting immunoglobulin from outside, so no memory is present because the host's immune system is not getting involved in the process of the production of the immunoglobulin. Okay, so there is no memory. In the case of the active immunity, it is long lasting usually. Okay, but in the case of passive immunity, it is short duration. Why? We have injected immunoglobulin, so immunoglobulin is not going to live for lifelong in the body of that person. No, immunoglobulins will be lost from the body after a certain time. So it is a short duration immunity. The passive immunity is a short duration of immunity. Then lag phase is present in the active immunity. Lag phase means the time duration during which the host immune system tries to know about the pathogen. Okay, so it takes, whenever some antigen or some microorganisms comes and infect a person, then the immune system of that person tries to know all about that pathogen, and in that time it prepares to know the way by which it can kill that pathogen. So in that time frame which is lost in knowing the pathogen, that is called as the lag phase. Okay, So that lag phase is present in case of the active immunity. But in the passive immunity, we are directly injecting immunoglobulin that will directly go and act over that pathogen now. So there is no lag phase. So lag phase is absent in passive immunity. Then booster doses are more effective. Booster doses are more effective because here we know in the active immunity that memory cells are present. So hence the booster dose is more effective, while in case of passive immunity no memory cells are present. So there is no role of booster doses. Then the active immunity develops slowly. The active immunity develops slowly. It takes time because it has to know the pathogen, then it has to activate the T cell, B cell, then it has to produce the antibody. So it is taking a lot of time now. But in case of passive immunity, we are directly injecting the immunoglobulin into the host. So that is faster. Okay, that is faster because we are giving the already prepared immunoglobulins from outside. So it is faster. Passive immunity is faster. Then the active immunity is useless in the immunodeficient people, because if we give the, suppose for example, if we give the measles vaccine, which is a live attenuated vaccine, to a child which is who is immunocompromised, then that live attenuated vaccine may cause infection or may cause harm to that immunodeficient child. uh, so that's why it is called that the active immunity. I mean, we cannot use the concept of active immunity in the immunodeficient people. But in case of immunodeficient people, we can inject the artificial immunoglobulins very safely. That will not cause any harm. Okay, so that's the difference between the two, active immunity and the passive immunity, and the different salient features of the two. If someone asks you to write a short note over the active immunity, then you have to start with the acquired immunity. That acquired immunity uh, is further classified into the active and the passive, and then you have to write about the active immunity, the definition, the types, and the salient features. Similarly, of the passive immunity, if they ask you to write the differences between the two, then from the start right from here. Start right from here. Okay, start right from here, from the definition, then types, and then the salient feature. Write all of these in the difference between the active immunity and the passive immunity. So this will fetch you a good marks. Okay, so that's all about the first part of the acquired immunity. Next we'll be talking about the second part of the immunity. Next we'll be talking about the immune responses in the active immunity, that is the primary immune response in the active immunity, and the secondary immune response um, in the the active immunity. So that will be in the second part of the acquired immunity.